make your case for why you decided to find a way to take the Medicaid money associated with the health care law.
Well, I mean, I think, first of all, we've got a lot of people that have been made promises to that have been ignored. The drug addicted, the working poor, and the mentally ill. Now, I can get my money back from Washington, and I want it back in Ohio because I know what they do with it in Washington. And I get to bring that money back. I get to free up money at the local level so that the mentally ill, the drug addicted, the working poor, and much broader set of services are available to people who live in the shadows. And I've made it clear if the federal government changes the rules or they pull the rug from under us, we'll withdraw from the program.
Give Governor Walker an area. I know you did an expansion up to 100% on Medicaid, I believe, right? 100% of poverty.
Well, we took my predecessor, Governor Jim Doyle, right, Democrat, had lifted eligibility for childless adults. That's really what we're talking about. Kids, pregnant women, seniors, for all of us are all covered. Right. So we're really just talking about adults without children. What I invoked was the flexibility, not that the Obama administration gave us, but that the Supreme Court gave us in that split decision. Because while they upheld the law, they gave states the right to do what we wanted to do on Medicaid. And so what we did was we said, I actually believe that Medicaid is for people living in poverty, not those above it. So I put eligibility down to 100% from 200%, eliminated the waiting list for people living in poverty for what we call Badger Care Plus, and transitioned everybody above it into the marketplace. Because I believe this Congress and this president, who can't even deal with not only a $17 trillion plus debt that they have, but a federal government that 2 years ago when I passed my last state budget, shorted me about 40% of the $600 million I had to put just in for Medicaid reimbursement as it is today without an expansion. How can we expect when the federal government's already shorting us? The larger philosophical thing, though, I think really goes to the heart of this, and that is I believe this president measures success in government by how many people are dependent on the government, by how many people are on Medicaid, by how many people are on food stamps, by how many people are on unemployment. I personally believe we should measure success in government by just the opposite, by how many people are no longer dependent on the government, not because we push them out to the cold, but because we understand that true freedom and prosperity doesn't come from the mighty hand of the government, it comes from empowering people with the dignity that comes from work.
Governor, just a couple things I'd like to say. First of all, we have seen significant improvement in the health care of a lot of people in Ohio. We have single mothers now who can get treatment who couldn't get it because they were up to like over 100% of poverty. 138% of poverty, go try living on it for a while. It ain't great. And now that we're up to 138% of poverty, these people are getting treated. Secondly, Ronald Reagan expanded Medicaid. Ronald Reagan expanded Medicaid, okay, because he said there were people that were left out. Do you understand that when people can't get comprehensive health care, they get sicker and then they end up in the emergency room, and guess who pays for it? We do. The people who currently pay the bills when they go in the hospital and have insurance.
Are you making a case that the Affordable Care Act's working?
No, let me tell you why that doesn't work.
Okay.
I'll tell you why it doesn't work, Chuck. Medicaid expansion allows us to do something, but the reason why the Affordable Care Act is bad is, first of all, it's top down, it has nothing to do with costs, and it's frozen jobs. We've got a program in Ohio it's payment reform. I think he's working a little bit on this, and let me tell you what we're doing. We're saying we want higher quality and lower prices, and insurance companies and providers will share. And I'm going to give you a perfect example. We have got our children's hospitals working on reducing the number of visits for children into the hospitals who have asthma. Because of that, the hospitals, they get less money, the insurance companies get more money. Guess what? They've come together to share the benefit. The ultimate answer on health care is related to the simple fact that we need to pay for quality and low price, and we can drive that. Now, we're not going to eliminate Medicaid. There's not a governor in America who doesn't have Medicaid. It's just a matter of how you run the program. Our program is grew the first couple of years by about 3%. I'm running $1.5 billion surplus in Ohio. Our credit rating is up. We've created 250,000 jobs, and we're helping a lot of people. Now, to me, that's a pretty good formula for my state. Not everybody's going to agree with it, but that's a good formula for my state.